The limitations of using DMEK in patients are, number one would be a patient that has a history of steroid response. So if I did a DMEK in the first eye or a DSEK and I realize that they have steroid-induced glaucoma, then I'm hesitant to do the same procedure in the other eye when I know they will have to use steroids post-operatively. So if there was an alternative where I could avoid long-term steroid use, it would be fantastic. An exciting advance in corneal transplantation or in Fuchs dystrophy has been this concept of descemetorhexis without endothelial keratoplasty or Descemet stripping only. It's known as both those terms. And what we found is in certain patients, their corneal edema is able to clear on their own by simply doing a 4mm descemetorhexis centered on the visual axis, and then following these patients post-operatively. In our study, we saw that they were all able to clear after about average 7 weeks. So recently in the journal Cornea, we published our series comparing DMEK patients with DWEK patients. And this was a real-world study in which we basically gave patients that had mild to moderate Fuchs dystrophy the option of either having descemetorhexis without endothelial keratoplasty or having DMEK. And we explained the two procedures and they chose which procedure they wanted. What we found is that the two groups of patients, the ultimate visual acuity was not statistically significant, but the time to reach vision of 20/40 was a lot faster in the DMEK group than in the DWEK group. We also found that there was a higher number of post-operative issues such as a high IOP, etc., in the DMEK group, and in the DWEK group or the DSO group, there were no post-operative issues of increased intraocular pressure. So I think that the right patient for descemetorhexis without endothelial keratoplasty or Descemet stripping only would be a patient that has mild to moderate Fuchs dystrophy with mainly central guttae, who is willing to be patient for their visual recovery, for their visual function to return. So and really it's nice if the patient has excellent vision in the fellow eye so that they have a good eye to depend on while their DWEK eye is healing. Because we found that it did take a much longer time for visual recovery. Also, we counsel these patients very carefully and let them know that immediately after surgery, their vision gets actually a lot worse before it starts to get better. So there is significant corneal edema immediately post-operatively, and if a patient is not anticipating this, they would of course be quite alarmed.